Hello, my name is Caitlin Hume, and today I'm going to be talking about rock climbing and associated hand injuries, specifically to the flexor tendon pulley system that is critical in climbing. Now, you might already be wondering what beta means. Beta in climbing is the sequence of movements pieced together to climb a route or boulder problem. Today, I'll walk us through the sequence of key elements on this poster. I'll discuss the anatomical complexities of the hand and the key structures that are at the highest risk of injury, types of rock climbing holds creating these high-risk injuries, as well as signs, symptoms, and treatment for different severities of injury. Due to the extreme nature of climbing, the proper biomechanics of the hand and associated structures, as we'll see, are essential for function. Now, before we dive in, let's take a look at our palms of our hands and the back sides of our hands and really look at them and recognize that hands are often taken for granted, even though they help us navigate the world, allowing for precise dexterity in daily activities that we don't even think about. This functionality is even more critical in rock climbing, and while rock climbing has gained popularity worldwide in the past decade, so has the increased risk and injury in flexor tendon pulleys. In order to mitigate the risk of these injuries, having a better understanding of the anatomical structure of the hand is key. Now, if we look in the lower left-hand corner of the poster, we'll see that the hand is a complex anatomical structure. It is composed of skeletal muscles, tendons, ligaments, joints, and 27 bones. To better understand the flexor tendon pulley system, there are several key structures to highlight. The flexor digitorum superficialis, FDS, and flexor digitorum profundus, FTP, are extrinsic muscles of the forearm that originate at the elbow. The structure of the extended tendons of these muscles act as prime movers to flex the fingers and wrist and provide gross motor skills. Only the tendons of these muscles extend across the wrist into each finger. The deep transverse metacarpal ligament beneath the tendons vertically anchor and stabilize the metacarpal phalangeal joints together. These are the joints that are between what would be your knuckles and your actual fingers. These joints allow for the flexion and extension and adduction and abduction movement inward and outward and are most subject to injury. The joints between each finger bone are known as interphalangeal joints. The distal interphalangeal joints, the proximal interphalangeal joint are the two interphalangeal joints that are most at risk for injury in a climbing injury. These joints both connect the phalangeals of the fingers with a hinge joint that permits flexion and extension. These ligaments can tolerate a modest amount of stretching, yet complications arise with overuse and excessive force. Surrounding the tendons of the FTP and the FDS are fluid-filled pockets known as synovial or membranous tendinous sheaths that act as shock absorbers to reduce friction between synovial joints and allow for fluid movement and flexion and extension of the fingers. Superficial to the synovial tendon sheaths are focal, thickened areas of fibrinous connective tissue known as flexor pulley tendons. They include the infamous transverse annular pulleys, A1 through A5, that wrap around the entire synovial sheath. The system works together to stabilize the tendons and provide full fluid motion with minimal friction during normal hand movement. Now, in climbing, that's ever more important. Now, if we move up to the center box at the top, the infamous flexor tendon pulley system, we see that the A1, 5, 3, 2, and 1 wrap around the flexor digitorum profundus and the flexor digitorum superficialis. These tendons extend to the distal phalanges and bear the force of muscle contraction during flexion. When the fingers flex, the direction of applied force changes by passing over the DIP, PIP, and MCP joints of the fingers. This functional system is known as the flexor tendon pulley system, and like the seatbelt in a car, the system functions to stabilize the tendons to the bone and also provide a fluid range of movement. Now, given that the hand is central for climbing, a finger flexor tendon pulley injury can be a climber's arch nemesis. We see a high occurrence due to the high degree of mechanical load that climbers apply to each finger when pulling on holds. Repetitive loading with high forces can bring on injury and overuse syndromes. In both bouldering and sport climbing, movements are dynamic and powerful that utilize a variety of holds requiring different hand grips. The two grips that involve the greatest degree of stress on the flexor tendon pulleys are the pocket and the crimp. And we're going to move down into that middle box there, the crimp and the pocket, and we'll dive deeper into what each of those are. The pocket is a hold in the rock, typically with little to no positive exterior edge, with widths that accommodate just about 1 to 2 to 3 fingers at max. And you have the infamous crimp, not grip. That is a small but positive edge that typically only the distal or your tip of the finger there can fit. Now, as climbs get harder, holds get smaller, which puts a lot more strain on each individual joint within your finger. Now, between the A5 and the A4 pulley there, that is your distal interphalangeal joint, which is your DIP joint. And then in between your A2 and your A1 is your MCP or your metacarpal phalangeal joint. And those two are an extension. So if you look down at the crimp photo in the middle of the box, you see how there's a little bit of a bowing effect, particularly between the proximal and the distal phalange there. That finger and those fingers are in extension, whereas your PIP or your proximal interphalangeal joint is in flexion. So that contradiction of extension and flexion puts those A4, A3, and A2 pulleys at a very high risk for injury. Now, as you'll see with the pocket, there's a similar motion in which the fingers are pulling. That flexion in the PIP and the extension in the DIP and the MCP joints are creating a similar effect and also creating a very high risk in using the pocket. Now, because the tendons of your fingers originate from your FDP, which is your flexor digitorum profundus muscle, and your FDS, which is your flexor digitorum superficialis, those tendons run along your fingers, and so all of that force is getting exerted at the A2 pulley particularly, which is estimated to be 3 to 4 times greater than at the fingertips alone. Estimations suggest that the recreational rock climber can subject the A2 pulley with a force load of 380 newtons. Now, to put that into context, a newton is a measurement of force applied on an object. 380 newtons is approximately 160 pounds. Now, imagine more than half of the climber's entire weight pulling on just the A2 pulley alone. And to further put that into perspective, imagine the weight of a 90-pound sack of concrete sitting on your stomach. This is the amount of weight that the A2 pulley can withstand. Now take a fall with momentum plus more than half of a climber's body weight, and an A2 pulley rupture is almost inevitable. The A2 and the flexor tendon pulley injuries are so common amongst the climbing community that the term climber's finger has become associated with this injury affecting the middle and ring finger most. Now, as we move to the upper right-hand corner of the poster, we'll look at signs, symptoms, and diagnosis of flexor tendon pulley injuries. And in order to properly diagnose the degree of injury to the flexor tendon pulley, a grading system has been developed. Grade 1 injuries are pulley strains with no split between bone and tendon in the MRI or ultrasound. A complete rupture of an A4 pulley and a partial rupture of the more essential A2 or A3 pulley are designated as a grade 2 injury, while complete rupture of the A2 or A3 is rated as a grade 3 injury. Grade 4 injuries include complex lesions with multiple injuries to the pulley or single pulley injuries combined with lumbrical muscle damage or collateral ligament rupture. The main signs and symptoms of flexor pulley injuries typically reveal a swollen, painful finger, bruising, and localized tenderness on palpation of the system. As a result, there's a loss of muscle power, function, and length of the tendon, which is inevitable. The patient also reports a loud snapping or popping sound at the time of injury. Moving down on the right-hand side to the middle box there, treatment and prevention. Treatment is going to depend on the degree of damage, as well as the recovery time is also going to depend on the severity of injury. With all 4 grades, there's a therapy, which can be conservative to a surgical repair under a grade 4, for instance. In all cases, there's going to be immobilization of the finger for an extended period of time. There's a functional therapy. There's typically different types of PT that would be advised in order to gain mobility and function back to the fingers and the joints. However, due to that synovial fluid within the synovial sheath there, the immobilization of the finger until it is healed creates an increased risk of the tendon adhering to the surrounding synovial sheath and therefore a loss of long-term finger motion. Conversely, early mobilization risks rupture of the tendon, so it is a delicate balance of immobilization and then slow remobilization until there is the recovery. Now, within that recovery and the pulley protection, there's going to be tape that would be used in a grade 1 and grade 2. Grade 3 to 4 would require a actual soft cast ring, and the recovery time is going to depend. You're going to have easy activity after a certain amount of weeks, but full sport activity until you're back to where you were before, depending on the injury, may never happen. But in good case scenarios, can be anywhere from 6 weeks to 6 months, depending on the grade of injury there. And in all of those cases, you are going to want to tape it with a climber's tape or just an adhesive tape to provide that extra protection around there in order to prevent additional injuries over time. Ultimately, we can say that the preventative measure that is best to prevent these flexor tendon pulley injuries is proper grip technique. And in gripping a crimp hold amongst the climbing community is to weight the hold at a full flexion angle, pulling on the tips of the distal phalanx to avoid conflicting extension of the DIP and flexion of the PIP joints. Now, overall and ultimately increasing awareness about the common injuries suffered by a fast-growing population of climbers could assist in injury prevention overall, and each climber should be conducting their own best practices to avoid injury and perform at their best. And so what we've learned today is that the flexor tendon pulley system is infamous in its high risk to injury on some of the high risk holds within climbing, such as the crimp and the pocket. We've learned what beta means within rock climbing, and we've also learned that there is a very complex system to the hand, and the anatomy is absolutely fascinating in my opinion. And with that, I did want to leave you with a quote from Kate Rutherford, who's a professional rock climber, and she states that I have so much gratitude for these hands that climb the rocks, paint and write, tie little knots for jewelry, and big figure eights for big walls. Hands, I don't know what I would do without you. Thank you for working so well. And I could not say it more eloquently as a climber and as a interested student in anatomy and sciences. Before we wrap up here, I'd like to thank the honors program at Miracosta College and the phenomenal team putting together this virtual Omni research showcase, as well as the UCSD's cadaver donation program for providing the cadavers in order to do the hand dissection and get a real deep dive on that anatomical structure there. Bio 210, the anatomy course there, and a very big thank you to my advisor and mentor, Corey Jones, for encouraging me to submit in the Omni and being able to lead a great anatomy class and an honors course for that cadaver portion. So with that, I hope you enjoyed the show there and that you learned something, and have a great day. Thanks.